Hi, my name is Dr. John Preston. I'm a professor of psychology at Alliant International University in Sacramento, California, and it's my pleasure to present this short video that takes a look at stress and anxiety, how to manage this. And I'm going to start with this quote from Jane Wagner, which I think is cute. Reality is the leading cause of stress among those who are in touch with it. Ain't that the truth? What we're going to do is the video is going to be divided into three parts. The first one is understanding stress and anxiety symptoms. Okay. Secondly, are some general approaches to reducing stress symptoms. And then finally, we're going to take a look at rapid stress reduction techniques and professional treatment for stress and anxiety disorders. So let's get started with part one. Lots of people talk about I'm under a lot of stress, but that's kind of a general comment. The many faces of stress, there clearly are sometimes where people experience enormous amounts of anxiety and stress-related symptoms, but it's situational. That is, it's limited to a particular situation or a particular period of time that once that's over, then it goes away. We're not talking about enduring problems with anxiety and that sort of thing, but it is clearly tied to particular circumstance. Secondly, there are people, and we all know these people, who are living continuously in situations that are very psychologically demanding and challenging. And so they may have prolonged symptoms of anxiety in large part because their circumstances don't change and they're having to deal with financial difficulties, discrimination, poverty, and so on and so forth. Third on the list are anxiety disorders. The anxiety disorders we're only going to talk about briefly in this video, but these are disorders that are very, very common. And they may, as it says here, they may or may not be related to stressful life events or circumstances. Now, there are some anxiety disorders that emerge in the wake of major life stresses. However, there are a number of these that seem to come out of the blue, and this would include disorders like panic disorder. We'll talk about that a little bit. Obsessive compulsive disorder, generalized anxiety disorder, and many of these are felt to be in part related to genetic factors and genetic vulnerability and biologically based. Anxiety disorders, unfortunately, are, with a few exceptions, tend to be very persistent. For instance, people that have panic disorder, if it goes untreated, it can last for decades. The same thing is true for obsessive compulsive disorder. And they are a disorder mainly by definition because they are so severe they really interfere with the person's functioning in life, not only causing a lot of suffering, but interfering with the ability to do a good job at work, school, or in social relationships. Here we have the yearly and lifetime prevalence rate of anxiety disorders. I'm not talking about stress in general, but I'm talking about these more severe psychiatric disorders. And you can see that over the lifespan, about 1 out of 4 people will experience these anxiety disorders. So they tend to be the most common of all the psychiatric and psychological problems, at least in the United States. This is a list of anxiety disorders. I'm not going to go over this, but this list with some explanations about the particular disorders can be found on this website. You can access that, look at it on the computer screen, or download to get more information about the particular anxiety disorders. We're going to focus a lot more on sort of general stress. So understanding stress, some definitions. Someone says, oh, I have a lot of stress. What does that really mean? Well, let's get technical about this, okay? The term stressor, first on the list, these are the things that activate a stress reaction, okay? So they can be events, like for instance, getting fired from a job, or having a breakup of a marriage relationship, or something like this. So concrete, identifiable events. But also, oftentimes there are thoughts that can provoke stress, and this is very, very common, and we're going to talk a fair amount about this. But an example might be, I don't know, if I'm going to get fired or not, but they're laying off a lot of people, and it could happen. So that's not an actual concrete event, but in my own mind, anticipation of something like that can generate a significant amount of stress. Then we have the stress response. and these are the particular symptoms. We'll look at that here in a few minutes. Worry. Let me take a minute to talk about this. Some people say, oh, I'm really worried about something. Worry really it is, as it says here on the slide, non-productive recurring thoughts. Now, there are people who are going through a really hard time in their life, and they're doing a lot of thinking, but sometimes it's not worry. Sometimes they're thinking, okay, now wait a minute, I got to get clear about what's going on here. So it's about trying to understand what's happened, and then problem solving, and that is kind of evaluating, okay, I could do this, this, or this, what would work out best. That's not worry, because that's the kind of thinking that leads to understanding and then also taking action. But worry is the same old stuff over and over and over again. It doesn't correct the situation, it doesn't come up with solutions, but it does generate a lot of anxiety. Let's make a distinction between fear and anxiety. There are some similarities. Some of the physical symptoms are similar, but with fear, what this is really about is, as the slide says, imminent and certain. So this is happening right now. I'm afraid of something, for instance, unambiguous. This guy is afraid, okay? This man does not have an anxiety disorder. This is real-time danger, and it ignites a fight or flight response. Now, in contrast, anxiety, most of the time, it has to do with anticipating things that may happen. They're not happening right now. So there's some degree of uncertainty or ambiguity about this, and it's not going to happen in the next few minutes. Again, a lot of symptoms are similar, but there are some differences here. I like to use this slide, the classic fight or flight response we all learned in Psychology 101 in college, and this CEO here's being chased by a saber-toothed tiger. The biologic response, oftentimes referred to as fight or flight response, is pretty much hardwired into every organism, or at least every animal. And it's when danger is perceived in the environment, immediately activates changes in hormones and bodily functions, brain neurotransmitters and so forth, that mobilize the body to take quick action to get away from danger. And clearly, real danger situations provoke fight or flight responses. But fight or flight responses, at least in nature, in all animals, including human beings, in nature, was really designed to handle very short-term stress that is also very potentially life-threatening. So in early human beings living in equatorial Africa 1 million years ago, or the gazelle grazing on some grass, watching out for lions, when we have a fight or flight response, typically there's rapid mobilization when danger is perceived, and you get all these massive changes in body function, but they usually last 3, 4, 5 minutes. Because in these natural settings, in a very short period of time, either you got away or you got killed. And so the biology of this is well adapted to activating people so we can survive in dangerous situations. But it's not well equipped for long-term stress, which a lot of us human beings experience. Many times there are stressors that just don't seem to go away. Okay, you'll pardon me, I'm not trying to be offensive towards mothers-in-law, but this is based on a long-term study I've done of my own mother-in-law. Or how about the Internal Revenue System? Anyway, let's take a look at symptoms. Now, on the website, you will have a list of symptoms. I'm going to run through this very quickly right now, and then if you want to download or look at the symptom list on the website, you'll have a chance to study it in more details. But typically, when people are experiencing fear or anxiety, they break it into 3 different groups of symptoms. First are thoughts. And here we have worry, the same old stuff over and over again. Obsessions, like I can't stop thinking about something. I have inaccurate conclusions like, oh, no, I know my wife's going to leave me, when in fact, maybe she isn't. People are constantly trying to predict what may happen, and there's a role for that. It helps people get ready to take action if they need to. But a lot of anxiety is generated by people making conclusions and predictions that really are not likely to happen. They could happen, but they're not likely to happen. And yet, in the moment, saying, gosh, what if I get fired? What if my lab test comes back and I've got some terrible disease and that kind of stuff? That tends to generate a lot of anxiety. Behavioral, we have avoidance. We'll look at some examples of this a little bit later. And then we have physical symptoms as well. And here's where a lot of people that are experiencing the physical symptoms of anxiety understandably become worried that maybe they're having some kind of a medical problem, especially one thing that people worry about is, am I having a heart attack? And so if people have things like rapid heart rate, for instance, tightness in their chest, and so on and so forth, they may think they're having a heart attack. And if you think you're having a heart attack, whether it's anxiety or not, you should always go to the emergency room. So here are some of the symptoms, and here's some other ones: lightheadedness, frequent urination, insomnia, and so forth. So there's significant biologic responses to fear and anxiety. Fear is much easier to determine where the cause is because people are pretty clear about the factors that they're reacting to. However, some anxieties are very situation specific, and these would be examples of phobias. An example would be maybe someone who has a fear of flying in an airplane, or someone who has a fear of public speaking. They're not feeling really anxious anytime, except more than normal, except when they have to be in that situation where they feel an enormous amount of anxiety. People can suffer from generalized anxiety disorder, and here the person's pretty much anxious all the time, even though there are not huge psychological stressors. It's the stressors of just normal living generate a lot of anxiety, and people with generalized anxiety tend to worry a lot. That's really at the heart of generalized anxiety. What if this happens? What if that happens? Next, we have panic attacks. And what I want to do in talking about panic attacks is I want to show you a video of a panic attack. This is a dramatization, but it is very accurate about the experience of somebody having a panic attack, and then explain how this is really quite different than most other forms of anxiety. Okay, so here I'm going to go ahead and switch to the video.
16, is that the Hawkins agency? Yeah. Well, that's a good company. I have a friend who works there. Have you been up to their offices before? Oh, no, of course not. Today's your first time. Listen, why don't you bring them down to our place and show them what a great job you did? Anyway, I'm sure you're going to do a terrific job. Do you remember Steve, my boss? Of course you do. Well, he talks about you all the time. It's amazing that you just... Linda, are you okay? I'm sorry. What? You don't look too well. I don't know. Something's wrong. I have to get off this elevator. I have to get off. I have to get off right now. Okay. God. Oh my God. We're dying. Linda? Linda, just sit here, okay? I'm gonna go get some help.
Okay, this is actually a very realistic dramatization of a panic attack, and here's what a panic attack looks like, okay? It's different than generalized anxiety or continuous anxiety or worry. It has a very sudden onset, and it rapidly escalates into extremely severe anxiety. By definition, a panic attack reaches its peak in 10 minutes or less, but the truth is a lot of panic attacks are like the one we saw on the video right here, where they last maybe 2 or 3 minutes. But almost never do they last more than 10 minutes, and then they begin to subside. Now, people in the aftermath of this may feel real shaken, of course, by the experience, but the actual attack itself is measured in a real short amount of time, okay? Panic attacks can be cued, meaning they can be, in people who have panic disorder, they can be activated by stressful situations. It's possible that getting into the elevator, in this case, was a cue that activated the panic attack. But many people who have panic disorder have uncued, and what that means in plain English is a panic attack just comes out of the blue, like you're sitting at home in your family room reading Better Homes and Gardens or something, and out of the blue you get hit with a panic attack. And obviously that really scares people, especially because it's hard to make sense out of that. Some people have panic attacks that are called limited symptom attacks. And it's the same thing. It has sudden onset, gets full intensity in 10 minutes or less, and then subsides. But here, it's not at the level of full-blown panic attacks. And so I want to mention a couple things about this, okay? Because we're not going to focus a lot on panic disorder, but I want to be very clear. When a person first has a panic attack, often some of the symptoms are racing heart, chest pain, shortness of breath, and this can be identified or misidentified as a heart attack. You should never assume that it's a panic attack if you have those symptoms. You need to go to the emergency room. Many of these symptoms, actually when you come into the ER, initially it's hard for the doctors and nurses to make clear diagnosis about is this panic or is this a heart attack until they get an EKG, get some blood work and that sort of thing. So there's no reason in the world to take chances about this. Now when people have had several panic attacks, they've been medically evaluated and find no sign of cardiac disease, then we're talking about a different story. But initially when this happens, it's always best to be on the safe side. Panic attacks can occur occasionally with really severe stress, but typically they're associated with panic disorder, which by definition people are having multiple panic attacks each week that seem to come out of the blue. And there are many people that their life circumstances have not been unusually stressful, but they just start maybe at the age of 27 or 32 or something, start having panic attacks. And these are more likely to be biologically based problems, and they do respond to treatment that we'll be talking about later on. Panic attacks are rare in children. We're looking at pre-pubertal children. And typically if you have a classic panic attack in children, that's kind of a big red flag that they may be experiencing some significant kind of psychological trauma. Not necessarily, but it's a warning sign that something may be going on in their environment that really needs to be evaluated very carefully. Things like either direct forms of child abuse, or they're witnessing domestic violence, or something along those lines. The importance of a diagnostic evaluation, just looking at the symptoms alone is not enough. And this is where visiting a primary care doctor, most diagnoses of anxiety disorders occur in a primary care setting. The average time of a primary care appointment, it varies somewhat. It's between 7 and 17 minutes. And that's really not enough time to adequately evaluate the history and the nature of the symptoms. It's going to be really important to talk to a doctor for a greater length of time, or a psychiatrist, or a mental health professional who are going to do a comprehensive evaluation. And this is not just looking at symptoms, this is looking at how did this start? What was the onset? What's the duration? How common is this occurring? Like if you have waves of anxiety or panic attacks, how many times per week? You want to see if it's associated with particular life circumstances and so forth to get a more clear picture about this. Many times people say, I don't have a clue about why I'm having all this anxiety. But for the last 6 months, I'm nervous all the time. I'm tense. I have trouble going to sleep. It's possible when people cannot identify a cause for anxiety symptoms that it may be something that's biologically based. In a little bit, we're going to talk about some medical disorders that cause anxiety. There are some drugs, prescription and over-the-counter and recreational drugs that cause anxiety. But also, there are times when people are very anxious due to life circumstances, but they haven't really gotten clear about why they're nervous. And a good example of this, and I've seen this a lot, someone comes in with significant anxiety symptoms, and they're being absolutely honest and straightforward and say, I don't really know why this is happening. And so they're with a therapist for maybe a session or maybe two to carefully take a look at their life. And it may become more and more clear over a period of time during that first 1 or 2 sessions that actually, in fact, there are things that have maybe increasingly become much more difficult, like decreased intimacy in a relationship, or the separation stress that parents feel when adolescents start to pull away from them, and so on and so forth. So if somebody says, I don't know why, that does not necessarily mean it's biologically based, because it could be psychological, but they just haven't quite figured it out yet. But it's also worth looking into the possibility that there may be a medical condition or a drug that is causing this. Is it a medical condition? We're going to take a look here briefly at medical disorders and drugs that can cause anxiety. And here we have slides. Nobody watching this video is going to be able to read all these slides and get useful information. So this is being posted on this very website. You can go to that and take a look at these various disorders that can and often do cause anxiety. But I want to talk to you about one of my own cases, and this is a case where I really blew it, where I didn't know what I was doing. I was in graduate school, and I was in my last year of graduate school, in my doctoral program, and for the first time I met the man who was going to be my father-in-law, and thinking I was this hotshot psychology student, I recognized right off the bat this man has generalized anxiety disorder, because this guy was just nervous all the time. He had ants in his pants. He couldn't sit still. He was just nervous, and pacing around a bit, doing this, for a long time. And I thought, well, this is obvious. This is generalized anxiety disorder. They taught that, in our psychopathology class. Yeah, well, guess what happened? A month later, they find out that he has a disorder called pheochromocytoma, which is a tumor on the adrenal gland, and it's relatively rare, but it can cause enormous anxiety and high blood pressure. And so he had that removed, and then he was just calm as could be. So this is just a good example of how, first off, I didn't know what I was doing, but also needing to not jump to conclusions about things until you thoroughly investigate that. Now, there also are a lot of drugs that can cause anxiety as well, and here's a list of them. And here I'm going to talk to you about another case that I did where I actually figured out what was going on. There's a guy who was in his early 60s, and he never had any history of severe anxiety. And about 6 months before I saw him, pardon me, he started having just a lot of anxiety all the time. And he was nervous, and he's in trouble going to sleep at night. And so his wife took him to his primary care doctor, and they ran some blood tests, and they didn't find anything. Eventually, he was referred to the psychiatry department. By the time I saw him, 6 months into this, he'd been tried on antidepressants and tranquilizers, and actually several other kinds of medication to treat the anxiety, and none of the drugs were working very well at all. And so he was referred to me just to get a second opinion or do psychotherapy with him. And the third time this gentleman did this, it's like a light bulb went off. He was sitting in my office, and he could hardly sit still. This poor guy was so nervous. But he reached in his pocket and pulled out a bottle of nasal spray and snorted nasal spray. And within 20 minutes, he did this 3 times. And the third time he did it, I said, "Excuse me, sir, but do you use a lot of nasal spray?" And he says, "Well, yeah, actually I do. I use a bottle per day." And you can see here we have nasal decongestants. And there are some people, now he wasn't abusing this. He wasn't getting a buzz or a high off of this, but he'd had some kind of, whether it was a sinus infection or allergy, I don't recall, but he started overusing this nasal decongestant, and at some point your body develops tolerance for that, and so he was having to use it frequently to keep his airway open. This is also true for oral decongestants like Sudafed, for instance. So again, we've got to keep in mind that we may have medical conditions or drugs that are causing the problem. Now, one of my professors in graduate school, who was from the deep south, said, "Y'all remember dogs can have fleas and ticks." And that's worth keeping in mind. And what he meant by that is sometimes someone presents with particular problems or symptoms, but it's not just due to one factor. There may be other things going on. I learned my lesson early when a man came to see me. It's my first year out of graduate school. He came to see me, and he had enormous anxiety, accompanying some depression and a lot of grief after his wife was suddenly killed in an automobile accident. And again, this man was just wringing his hands and could hardly sit still. And it was later determined, after I started doing psychotherapy and we started with antidepressants, that he has hyperthyroid. He has thyroid disease. And that's why he wasn't getting better. And I made a big mistake assuming that there was, it's a no-brainer. His wife is killed in a car wreck, And after that, he starts getting really anxious. That's what's going on here. Well, of course, that's a lot of what's going on here, but he had the misfortune of having the thyroid condition really start to get ignited around the same time that this life event occurred. So we have to cover all of the bases and always make sure that there isn't some kind of underlying medical problem that is either the cause or is contributing to the symptoms and interfering with treatment being successful. Okay, so welcome to part 2. General considerations for the treatment of anxiety. This is a topic we've talked about for a really long time, but I'm going to try to condense this. And let me state the obvious, and that is, if it's determined that there's a medical condition or it's being caused by some kind of drug, then the obvious thing is to treat the disorder or to try to address the drug or drug abuse. Beyond that, there are a number of techniques in general for people who are experiencing significant stress that can have an impact, a positive impact on the brain, which results in better stress tolerance and decreased stress symptoms. So let's take a look at this. We're going to look at 4 things under this category. First off, eliminating substances that cause anxiety, improving sleep, the role of exercise, and also a little bit on psychiatric medications. This is one of my very favorite slides. Probably the most common drugs that's used that causes, at times, enormous anxiety is caffeine. Of course, it's not just limited to coffee. There are many things that we ingest that contain caffeine. But let me just show you an example of this. In this particular study, at noontime, they gave to healthy adult volunteers 500 milligrams of caffeine. It was given to them in pill form, and they either got the real caffeine or a placebo. And then by 6 o'clock, they went in and they got a blood sample from these 2 groups. And by 6 o'clock, the group who had ingested 500 milligrams of caffeine at noon had 32% higher levels of adrenaline in their bloodstream than the group that had ingested placebo. Now, for point of reference, 500 milligrams is equivalent to 2 mugs of coffee. And I would encourage you, or any family members that are experiencing a lot of stress, to evaluate the amount of caffeine that you or they are consuming. And available on this website is a free download. It's a caffeine questionnaire. It's a very straightforward way to determine the amount of caffeine that a person is using on a daily basis. Reducing caffeine, therefore, oftentimes itself can significantly reduce anxiety. Number 2, improving sleep. Sleep really is the guardian of the brain. According to Shakespeare, it's the bath and balm of hurt minds. Any emotional problem, whether it's depression, bipolar disorder, and panic disorder, or generalized stress, is going to be more significant and harder to deal with if a person is getting poor sleep. Let me talk very briefly about the kinds of insomnias that occur. These are things, interference of sleep, that people are really well aware of, okay? The first is seen mostly with anxiety and generalized stress, and that is difficulty falling asleep. Typically, if stress or generalized anxiety is the culprit, then when people are able to go to sleep, typically they stay asleep, but the trouble is falling asleep. With depression, a person may or may not have trouble going to sleep, but the biggest problem with depression is staying asleep, waking up a lot during the night, tossing and turning, and then early morning awakening. And the last thing is sleep inefficiency. Now, sleep inefficiency has to do with the quality of sleep, and this can only really be measured precisely by looking at brainwave activity in a sleep laboratory. Now, most people do not need to go to sleep laboratory, but I just wanted to mention that's where they get the information to determine if a person is having problems with restorative sleep. In a nutshell, as probably everybody has been exposed to sometime in your education, people go through different phases of sleep at night. On top we have the dark bars represent rapid eye movement sleep where dreaming occurs. But I want to focus primarily on stages 3 and 4, and these are the phases of sleep that contain deep restorative sleep. And I want to call to your attention that the first episode of deep sleep, now this is for middle-aged adults, it's going to be different for elders. The first episode of deep sleep occurs probably 20-25 minutes after falling asleep, and it also tends to be the largest slice of deep sleep that you get the whole night through. And this is going to be relevant here in a few minutes when we talk about some other issues. What happens if you don't get deep sleep? There are people that sleep 8 hours a night, but if they're not getting enough deep sleep, restorative sleep, everybody is going to feel tired. It's probably obvious. Increased anxiety, their ability to control anxiety symptoms, and also trouble staying focused and concentrating are going to be impaired. Disturbed sleep. Different reasons that people are not getting adequate sleep. One of these is they choose to sleep less. And this is just staying up too late. That's all it really means. Sometimes people enjoy doing this. They stay up late to watch movies or be on the internet. Often, however, when people are experiencing a lot of anxiety or stress, they may be staying up late as a distraction from worrying about things. And so they are not getting enough sleep, but they, in a sense, stay awake long enough that then they can fall asleep because they're so tired, but the result is they're not getting enough sleep. Chronic pain can, for many reasons, significantly interfere getting quality sleep. Substances. These are the primary ones: alcohol, tranquilizers, and some sleeping pills. What do they have in common? One is about 15% of people that take or that use alcohol and prescription tranquilizers and sleeping pills will abuse them. They can become addicted to these. They get a rewarding feeling, a high off of this. Most people don't. The majority of people don't abuse these drugs. However, many people who are under a lot of stress use and overuse some of these drugs as a way of self-medicating, primarily to help them calm down from anxiety and especially to go to sleep. So there are many people that will say, well, 3 glasses of wine before bedtime and it really helps me go to sleep. Otherwise, I'll lie there for an hour tossing and turning. The same thing could be said for tranquilizers and most prescription sleeping pills. Here's the point. These drugs they sort of mask a problem. The person thinks it helps me because I go to sleep better, but what they don't realize is all 3 of these substances, especially alcohol, but all 3 of them reduce the amount of time spent in deep sleep. Let's talk about caffeine. Excuse me. It may be hard to really figure out how could a person who is under a lot of stress or having enormous anxiety problems increase their caffeine use when they're stressed out, since caffeine increases adrenaline and stress symptoms and interferes with sleep. And it's a fair question, and probably the reason for that is because people who are going through enormous stress are not sleeping well and they are exhausted. And they're drinking coffee or tea or cola or something like that, like a lot of us, to stay awake so that they can work, so they can not fall asleep in school, so they can drive safely and that kind of thing, without realizing that actually the caffeine is one of the most potent drugs actually that can increase anxiety symptoms and interfere with sleep. So you can go to, I think I mentioned this before, the website has a caffeine questionnaire where you can determine the total amount of caffeine being consumed. Included here are, in the last 5 years, energy drinks that have a lot more stimulating herbs and dietary supplements in addition to caffeine in there, so that can be a big problem as well. So caffeine directly causes anxiety symptoms, all right? It interferes with the ability to go to sleep, and it may reduce the amount of time spent in deep sleep, and that's an important point. So really when people are experiencing enormous stress, then it's important, if at all possible, to gradually get down to no caffeine at all. If a person's drinking 4 cups of coffee a day, if you stop cold turkey, there's going to be caffeine withdrawal symptoms, which can be very unpleasant, headaches and jitteriness and that sort of thing. So it may take a month to gradually wean yourself off. For some people, having a cup of tea or coffee in the morning may be okay, but it's extremely important not to have any caffeine afternoon, because that's where it can still be in your bloodstream by the time you go to bed and interfere with the ability to go to sleep and to get into stages of deep sleep. We also have sleep disorders that oftentimes go unrecognized. These are common, they can last for years, and they are notorious for interfering with deep sleep. And yet, even though they go untreated sometimes for years, they're very treatable. And these are the 2 primary sleep disorders that are most common are obstructive sleep apnea. Let me just explain what this is. This occurs in up to a fourth of men and 10% of women. So it's real common. And here the person goes to sleep and their airway begins to collapse and they cannot get air past the collapsed airway. So it causes them with great exertion to inhale and suck air past the collapsed airway. It makes a lot of noise and then they feel okay for 15 seconds. But then the oxygen supply in the bloodstream starts to drop because they can't get through the collapsed airway. In other words, they're going to have multiple episodes of what is called apnea, and that's this gasping kind of sound. And this may involve 200, 300, or 400 times per night. Now, most people who sleep with somebody like this are going to notice this and say, hey, buddy, there's something wrong with you. It could be a partner, a wife, or a husband. But what's really common and maybe kind of surprising is a lot of bed partners, they hear this, but within days, they just habituate to it. They just start tuning it out. And so there are people that are sleeping with somebody that have sleep apnea that's been going on for years, and their bed partner doesn't know. So in evaluating this, we want to ask if they do have a bed partner, what their observations are, if they have any of these particular symptoms of gasping for air numerous times during the night, and then severe restless legs syndrome can really interfere with deep sleep. Both of these cause a decreased ability to control emotions, in particular anxiety. And I should say, as an aside, a lot of restless legs can be resolved by eliminating caffeine. There are some other causes for restless leg syndrome, but caffeine can either cause or intensify that particular symptom. How do you improve sleep? Okay, this needs to be brief, but here are a few things worth taking a look at. Worry is a frequent cause of insomnia. This cartoon says, I can't sleep, I think I'll get up and solve all my problems. And the problem is, and all of us from time to time experience this, is these thoughts going through a person's mind again and again and again. Worry, like I described before, not problem solving, okay, not adaptive, but they generate anxiety and keep people awake. So there are two approaches that are quite effective in many people who have trouble falling asleep because they can't shut off a busy brain. Let me do the one on the bottom first, and that is to sit down and maybe an hour or half an hour before going to bed, get a pencil and paper and write out a to-do list for tomorrow. Lay it down, and many people then can go to bed and go to sleep. It's surprising and remarkable. This may work for about 50% of people. It seems so simplistic that it wouldn't work, but this is one of those things that's great that you can do an experiment. Do it one time or two times and find out if it works. And I've had some patients say, you know what, that really works for me. Okay, so that's one strategy. The other strategy has been developed by a really quite well-known researcher, James Pennebaker, psychologist, and his approach is not an hour before bed, but right before retiring to bed, is if you notice yourself, just all these worries going through your mind, is get out a piece of paper and pencil and write down verbatim, what's going through your mind. Okay, so for instance, it may be that the person writes down, there's increasing pressure at my work to do more. I'm having to work through lunch hours. I'm really afraid that if I don't do this and start taking home work on the weekends, that I'm going to be in that group of people that are going to get laid off, and that could be a disaster. Now, if you just write down work problems and financial problems like an outline, that isn't going to do it. But what this guy is doing is he is writing verbatim the thoughts that are going through his mind, and remarkably, more than half of people that do this will find that their brain just shuts off in terms of the worry. I don't know why exactly this is the case, but it's likely that there's something about this inarticulated, vague worries. Once you put them down on paper, they're more conscious, they're more concrete, and in a sense it's kind of like getting it out of your system. So again, this is a very good experiment to do to see if this actually does work. The one group of people who should not do this technique, however, are those that have experienced really severe psychological trauma. Because if you begin writing about traumatic experiences, it may open up the floodgates and cause enormous anxiety. So that certainly is one group where this is not recommended. Another approach to helping yourself fall asleep is to get bored. And really there's two sides of the coin. One is, that one. Okay, let me start over again. All right, take two. Another approach to falling asleep is to get bored. there are really two sides of the coin. One of those is to avoid things that are too exciting and too stimulating. These are things like exciting television shows, Monday Night Football, and things like that. I mean, these things are important as a part of our life, but when people are going through really stressful times, what may be more important is to get good sleep and really get a handle on stress and anxiety and plan some of those activities for earlier in the day or on the weekend. Then there's getting bored, per se. And the old adage was count sheep. And I remember hearing this ever since I was a kid. There was a study done about 10 years ago in England where they tested this out. They had people that had long-term insomnia, excuse me, and they divided them into 4 groups. One was a sleeping pill, prescription sleeping pill. One was a placebo. One was to teach them relaxation exercises, and the final thing was to count sheep. And as you might imagine, the technique that did not work at all was counting sheep. So in principle, if you could count sheep, it'd probably be boring enough to help you go to sleep. But the problem is when people are really undergoing a lot of stress and their life is enormously difficult, it's just hard to close your eyes and imagine and sustain an image of a sheep or anything else boring